Hi, my name's Sam, a pharmacist from Rochdale. So today I'm just going to briefly talk about the common cold. During the winter months, a lot of patients are coming in complaining of symptoms of the cold. So they might get a bit of a headache, a temperature, a runny nose, might feel generally bunged up, have a cough, and just feel run down. But not to worry, these symptoms are usually self-limiting and they usually last between 1 to 2 weeks. But because there's no real cure for the cold, we want to try and prevent the spread of it. So if you're going to cough or sneeze, try doing some tissue and pop that into the bin. Wash your hands regularly, clean your surfaces, and if you're out and about, use some antibacterial hand gels. In terms of treatment, we just want to try and treat the symptoms. So if a lot of our patients say that paracetamol, ibuprofen, just any painkillers usually generally help. You might find that a warm drink, maybe some tea or some honey and lemon drinks might also help. But I can get some things over the counter as well, some decongestants and some cough mixtures. But just check with the pharmacist because they're not all usually safe to use if you've got certain medical conditions or you're on certain types of medication. When to see the doctor, like I said previously, the symptoms usually last between 1 to 2 weeks. So if you've got symptoms longer than that, say for example longer than 3 weeks, you might want to pop in to see a doctor, see if it's anything more serious. Maybe if you're coughing up and it's hurting your chest, or you're coughing up a bit of blood, you might want to see a doctor then, or you're feeling a bit of breathlessness. But not to worry, if you've got any other questions, come down to the local pharmacy. We're always happy to help you guys.